1. Which adult learning principle is most relevant when training diagnosticians to interpret psychoeducational assessments? A. Learners prefer passive listening. B. Learners need immediate applicability of knowledge. C. Learners rely primarily on rote memorization. D. Learners thrive without real-world context. 2. In developing an NCED preparation curriculum, which step ensures that training aligns with IDEA requirements? A. Selecting instructional media. B. Conducting a regulatory compliance review during design. C. Collecting post-training satisfaction scores. D. Distributing optional reading materials. 3. When mentoring a new diagnostician, which approach best supports critical thinking during eligibility determinations? A. Giving them the answer key to case studies. B. Asking them to explain their decision-making process. C. Restricting them from making recommendations. D. Providing only scripted responses. 4. Which evaluation method best measures whether diagnosticians can apply new knowledge in real eligibility meetings? A. Reaction surveys. B. Performance-based simulations. C. Attendance records. D. Self-reported confidence ratings. 5. During training on FERPA compliance, which adult learning strategy is most effective? A. Presenting the entire law verbatim. B. Using real-life confidentiality breach scenarios for analysis. C. Requiring participants to memorize all sections. E. Avoiding group discussion to save time. 6. Which communication method is best when delivering urgent updates about changes to special education regulations? A. Quarterly newsletter. B. Annual workshop. C. Real-time virtual briefing. D. Post-training survey. 7. A trainer uses feedback from pilot groups to revise NCED prep materials before final rollout. This is an example of A. Summative evaluation. B. Formative evaluation. C. Outcome evaluation. D. Norm reference testing. 8. To ensure that diagnosticians can correctly score cognitive assessments, which curriculum component is most effective? A. Reading theoretical articles only. B. Live scoring practice with sample protocols. C. Watching pre-recorded lectures without interaction. D. Reviewing historical case law. 9. Which mentoring technique best fosters professional growth for diagnosticians struggling with report writing? A. Critiquing their work privately with constructive feedback. B. Publicly highlighting their mistakes in team meetings. C. Allowing them to continue without intervention. D. Giving them templates without explanation. 10. Which regulation most directly guides confidentiality and privacy in educational diagnostic practice? A. HIPAA. B. FERPA. C. ESSA. D. Section 504. 11. In the ADDIE model of instructional design, which phase comes first when creating NCED exam preparation training? A. Design. B. Implementation. C. Evaluation. D. Analysis. 12. Which communication barrier most interferes with collaboration between diagnosticians and general education teachers? A. Shared use of plain language. B. Use of excessive technical jargon. C. Frequent team meetings. D. Written summaries of findings. 13. Developing a case study based on a complex eligibility determination for training purposes is an example of A. Summative evaluation. B. Experiential learning. C. Peer review. D. Compliance auditing. 14. Which mentoring model is most effective when a senior diagnostician supports multiple interns simultaneously? A. Reverse mentoring. B. Group mentoring. C. Peer mentoring. D. Distance mentoring. 15. During curriculum development, which step ensures that assessment training aligns with state special education guidelines? A. Creating a general agenda. B. Conducting a compliance review. C. Collecting end-of-course surveys. D. Scheduling follow-up sessions only. 16. In Kirkpatrick's evaluation model, which level measures diagnosticians' ability to implement evidence-based recommendations? A. Level 1, reaction. B. Level 2, learning. C. Level 3, behavior. D. Level 4, results. 17. Which adult learning characteristic should guide training on new assessment tools? A. Desire for immediate relevance and application. B. Dependence on the instructor for all learning. C. Preference for lecture-only delivery. D. Lack of prior experience to draw upon. 18. What is the best method to verify diagnosticians' understanding of new dyslexia identification guidelines? A. Post-training knowledge quiz with scenario-based items. B. Recording attendance only. C. Collecting informal anecdotal feedback. D. Sharing guidelines without testing comprehension. 19. When mentoring a diagnostician about culturally responsive assessment, which strategy is most effective? A. Discussing case examples from diverse populations. B. Asking them to read policies without guidance. C. Avoiding discussion of sensitive issues. D. Providing no feedback until end-of-year review. 20. To measure the long-term impact of RTI training on eligibility decisions, which evaluation method should be used? A. Immediate reaction survey. B. Tracking referral data trends over time. C. Counting number of trainees. D. Collecting training completion certificates. 21. Which communication strategy is best for presenting complex evaluation data to parents? A. Use plain language and visual aids. Overload the conversation with technical terms. C. Provide raw test scores only. D. Avoid allowing parent questions. 22. In curriculum design, which document clarifies what diagnosticians should be able to demonstrate after training? A. Learning objectives. B. Course outline. C. Instructor guide. D. Resource inventory. 23. Which type of evaluation ensures that NCED exam prep materials are revised before full implementation? A. Summative evaluation. B. Formative evaluation. C. Cost-benefit analysis. D. Longitudinal study. 24. Which adult learning approach accommodates diagnosticians with limited time and varied schedules? A. Self-paced online modules. B. Mandatory all-day workshops only. C. Random live sessions with no replay. D. Exclusive lecture delivery. 25. Which mentoring approach helps diagnosticians feel supported when discussing challenging eligibility cases? A. Encouraging confidential, open dialogue. B. Criticizing their decisions publicly. C. Avoiding one-on-one discussions. D. Restricting feedback to formal evaluations only. 26. The primary purpose of a training needs assessment for diagnosticians is to A. Evaluate instructor performance. E. Identify gaps in knowledge and skills. C. Measure post-training ROI. D. Track attendance compliance. 27. Creating scoring rubrics and fidelity checklists for diagnosticians falls under which ADDIE phase? A. Analysis. B. Design. C. Evaluation. D. Implementation. 28. Which strategy best ensures consistent compliance with evaluation timelines across districts? A. Sending annual reminders only. B. Providing targeted training with ongoing monitoring. C. Leaving procedures to each school's discretion. D. Waiting for state audits to reveal gaps. 29. What is the most effective real-time communication tool for mentoring diagnosticians during live ARD meetings? A. Quarterly newsletter. B. Instant messaging or live chat. C. Post-meeting debrief only. D. Pre-recorded webinar. 30. In professional development for experienced diagnosticians, which activity leverages their expertise most effectively? A. Leading peer discussions on complex case law. B. Memorizing isolated terminology. C. Listening to lengthy lectures only. D. Reviewing outdated case studies. 31. Which metric demonstrates the organizational impact of diagnostician training most directly? A. Number of training hours completed. B. Reduction in compliance violations. C. Number of attendees per session. D. Satisfaction ratings only. 32. Which mentoring strategy best prepares diagnosticians for leadership roles in special education? A. Assigning them to lead multidisciplinary team meetings with support. B. Keeping them in observational roles only. C. Providing them only theoretical materials. D. Avoiding leadership exposure entirely.